Hey everyone, today we're going to talk about our skeleton. It's on page 31 in your study guide. There's a lot of things that we need to know about the bones, and they're not difficult, they're just common sense, and these are things that we can give. It's information that you're giving to your students so they could be more aware of their physical body and how to take care of it. So the first thing that you need to understand is a bone is a dynamic living tissue that forms the body's structural framework. So if I asked you what a bone is, that's a great example of what a bone is, right? Okay. The bone mass is composed of organic and inorganic materials, including calcium salts, connective tissue, yada, yada, yada. All of this together, when we put it together in the bone, it makes the bone have a tensile strength that of steel. It is so strong, but yet it is porous and it gives. Yeah? So this is what I want you to think about. Does bone have the quality of sthira-sukha? Write that down. Regular practice of yoga is beneficial for your bones because it gives healthy stresses upon the bone. If, my loves, we do not walk or move around, our bones have no stresses placed upon them, which creates density in them. If there's no density in the bone becomes brittle and they could break. When we get older, especially women, we get, or men actually get it as well, but not as prevalent. They get a disease of the bone called osteoporosis. It's a bone disease that the bone is not dense anymore. Applied weight to a bone is going to give it density. If I'm doing a body workout with my body weight, like in yoga, I can put more density to my bone. Now, it's not going to happen overnight, but we want to do that. Walking, yoga, things of this nature, weightlifting, is going to help the bone create density. We're placing healthy stresses upon the bone. Bones are the body's reservoir for calcium, critical in various psychological functions, including muscle contraction. In your journals, I want you to explain what is the disease or a bone mass loss. I just told that to you. The bones of the skeleton link together at the joints, and they act as levers for the muscles that cross the joints. There's different shapes of bones: long bones, short bones, flat bones. So give me examples of some of these bones. A long bone could be my femur or my humerus. A flat bone could be my heel, my calcaneus, or my scapula. A short bone could be my vertebrae. Does that make sense? So think of this in terms of examples. Think of this in terms of things that we can use on an everyday basis. The word asana means a comfortable seat or comfortable position. Yoga postures approach effortlessness when we align the axis of the bone with the direction of gravity. Understand that. We'll use muscular force to bring the bones into position where they can carry the load. Once these positions are attained, muscular force is no longer necessary, right? Or greatly decreases. So, these are the fundamental bones that you need to know on Fred. Your clavicle, scapula, sternum, humerus, radius, ulna, ilium, sacrum, pubis, femur, patella, fibia, tibia, phalanges, metacarpals, carpals, tibial tuberosities, and the bones in your ankle, your hind foot, your midfoot, and your forefoot. And we'll go over them again in another video. Have a great day.